Testing, testing. Good morning, ladies and gentlemen. I'm Matty, your chairperson for the sessions. Welcome to Symposium S14, Benefits and Precautions on Massage Therapy. So here's our background about our next speaker, Dr. Anjali. Dr. Anjali is a young and aspiring Ayurvedic physician driven by the passions of an ancient science of Ayurveda. She's a millennial devoted in inculcating a sense of well-being and promoting health lifestyles through Ayurvedic practices. She spent her early years in the tutelage of her aunt, in a renowned Ayurvedic physicians in Kerala, and currently motivate her to actually continue to pursue Bachelor's of Ayurvedic Medicines from MCHA Medical University. And she has set up the practice since 2012. She currently holds a postgraduate diploma in hospital management from Annalam University. Dr. Anjali has been subsequently practicing as Ayurvedic consultant at various Ayurvedic centers in India and Malaysia for more than 5 years. By continuously upgrading her knowledge and a keen sense of learning, Dr. has recommended Ayurveda as an effective tool for healing which can bring about a paradigm shift in our daily lifestyle to promote sustainable well-being. She provides nutrition and lifestyle consultations and encourage people to take charge of their own health, customized advice on dietary and lifestyle changes. Her main expertise in treating in various medical conditions like indigestion, fibromyalgia, Parkinson's disease, psoriasis, paraplegia, hemiplegia, scoliosis, arthritis, diabetes, and etc., which earns her a reputation as a leading Ayurvedic consultant in Malaysia. So with that, let us welcome Dr. Anjali for the talk.
Good morning. Thank you for introducing me. And here today, we are going to speak about the benefits of massage therapy and its underlying precautions. You know, self-care is a word that we've been hearing a lot lately on the internet and on the health magazines and all. So what does the self-care really mean? And why is it so important in the present times? I think one of the main reasons is that we are living in a highly stressful world, and we are stressed out of a lot of things about our job, about the career, about our family, about even traffic jams. So caring yourself by doing a massage or by preventive measures of many complementary medicine are all being given a lot of importance lately. And I think one of the reasons is people are really taking care of their health, and they are doing it on their own. So it is one of the most important thing that you should do nowadays, especially during the pandemic era. So coming back to self-care, I think it is the most important thing is to de-stress yourself, or is to take care of your body so that you can prevent diseases and you can have a healthy aging or healthy long life. So when we think about self-care, what's the first thing that come to our mind? Definitely loving yourself, and massage therapy is one of the things that everyone think of. There are a lot of people who don't like massages, but I think most of the people would love to go for a massage. So here today we will speak and we will discuss about the benefits of massage therapy, its effect on different systems in our body, and at the same time the contraindications and the precautions that need to be taken while undergoing a massage therapy. So as you all know, massage is a general term for pressing, rubbing, and manipulating your skin, muscles, tendons, and ligaments. And massage therapy, it involves skilled manipulations of bodily tissues using diverse techniques of pressure and movement certified by professionals to relieve bodily tension, pain, and stress. Also, it offers long-term benefits to our health, and thus it became a part of complementary and integrative medicine recently. So massage therapy is a therapeutic approach of massage, and it is usually performed by a certified and licensed massage therapist. So there are different type of massages available, and there is manual and mechanical massage. Manual is, how a human being will do or perform massage. Mechanical massage is something like we come across massage chairs and all, where we get it in the rest and go stations and all. So when it comes to manual massages, we have different types of massages available: deep tissue massage, Swedish massage, aromatherapy, lymphatic drainage massage, Ayurvedic massage, hot stone, Malay massage, Thai massage, Balinese massage, and Chinese massage. There are a lot of different types of massages are available all around the world. But generally, all around the world, you can see Swedish and deep tissue, as well as lymphatic drainage, aromatherapy, Ayurvedic massage quite frequently being performed on therapeutic levels. So what happens when we undergo a massage? So when someone uses their hand and body to perform a massage, what happens is there are usually two type of responses. One is called mechanical response, which is a response to the pressure, force, and range of motion. This is usually and examples of mechanical response are increased blood circulation, reduced swelling, and reduced formation of scar tissue. Reflexive response, on the other hand, is stimulated by nervous system. It's a reflex. And what happens is parasympathetic and sympathetic nervous system. So the sympathetic nervous system get the action of it get a bit slow, so that the heart rate, blood pressure, everything gets slow, and there will be rhythmic breathing. So these are the two type of responses that we usually get in a massage. What are the physiological effects? What are the benefits or effects on each system in our body? We have a lot of different systems working in a well coordinated way: circulatory, lymphatic system, nervous system, integumentary system, muscular system. So we are going to discuss how massage is going to affect each and every of the systems in our body. So let's talk about cardiovascular system. As I said earlier, what happens when we massage? The first thing is usually a reflexive response happens, and it dilates our blood vessels. And naturally, when the blood vessels are opened or dilated, more blood will flow into each and every tissue or cell or organ in our body. That leads to improved blood circulation. And improved blood circulation as well as vasodilation also helps to decrease the blood pressure. And also it creates hyperemia. The redness that usually appears, as well as increased blood flow to the tissues and organs. Feed cells and tissues. When there is increased blood flow, nutrient exchange between the blood as well as the cells increases. So the cells get more, cells or tissues or organs get more nutrition, and thereby it leads to better growth. Promotes removal of metabolic waste. Circulation again is the important reason why it happens. Massage reduces ischemia. Ischemia, as if it is reduced blood supply to your muscles or other parts of the body. So while doing massage, since it improves blood circulation, naturally it reduces ischemia, reduces heart and pulse rate. Also, it leads to the increased production of red blood cell and white blood cell count, increased oxygen saturation, and enhances the adhesion of WBCs, which is one of the main component in immune system. Let's go to lymphatic and immune system. In lymphatic system, one of the main system that is responsible for immune function in the body. It is responsible for the production of lymphocytes and all. And naturally, compared to cardiovascular system, it doesn't have a pump. Cardiovascular system blood is circulated through our body with the help of our heart as well as other arteries and veins. But when it comes to lymphatic system, lymph is circulated through through the contraction of muscles as well as pressure effect on your abdomen and your lungs through the breathing, or even as a massage. When you massage, this particular circulation is being improved. So the mechanical action of massage resembles with that of the normal muscle contraction, and massage facilitates the forward movement of venous blood as well as the lymph. So it reduces the chances of stagnation. So definitely it promotes lymph circulation, increases the lymphocyte count, increases the number and function of natural killer cells, CD4 cells, CD4-CD8 ratio. Because there is no stagnation, lymphatic massage, especially the lymphatic drainage massage, really promote the production of lymphocytes and movement of lymphocytes throughout the system and clearing of the unnecessary waste that is getting accumulated over there. Integumentary system is basically consists of hair, skin, and nails. So naturally, when we are doing a massage, there is a friction between the hand of therapist and onto the skin of the person, and it leads to friction, and thereby there will be increased rise in temperature. It does facilitate the sebaceous secretions from exocrine glands that are present on our skin, which leads to the production of more sebum, more sweat, and oil glands. Thus improves the lubrication and appearance of the skin. It can make your skin more supple, more soft, and moisturized. Dead cells are removed by the constant contact of the hand over the skin. Sweat glands, hair follicles, and sebaceous glands thus become free of obstruction and can function more effectively. So doing a head massage or a scalp massage can really have a good impact on the hair follicles. It can, the supply to the scalp increases, the oxygen supply and blood supply to the scalp increases, thereby promoting more nutrition availability for the hair follicles. Nervous system, one of the main system. You all know nervous system has a very important role, especially when it comes to stress and anxiety. So massage typically has a calming and balancing effect on the nervous system. When massage is applied, the nerves and sensory receptors are stimulated, and messages are sent along the nerve pathways via the spinal cord to the brain. The parasympathetic system that slows down the body activity, such as reducing heart rate, lowering blood pressure, and decreasing the amount of sweat. We talked about the parasympathetic and sympathetic system. Sympathetic system of the nervous system is responsible for the flight and fight mechanism. That is, when you are stressed, when you are under stress, naturally the sympathetic system will be more active and more hormones and enzymes are secreted to fight. Suppose you are being hunted by a tiger or a dog, naturally our body will contract, our muscles will be active, there will be less production of digestive acids, and a lot of system gets slowed down. There will be a lot of contraction and tension inside the body. So this is what even happens when we are normally stressed too, not only when we are being chased by a dog or a tiger. No, even when you are stressed because of your career or other life choices, this is the same reaction that body gives. But the massages basically stimulate the parasympathetic system, as well as it slows down the activity of sympathetic system, so that more endorphins and happy hormones and are secreted, thereby relieving you from stress and anxiety. Another again important system is endocrine system, responsible for the production of hormones inside our body. We have a lot of endocrine hormones and glands that are present, which are like right from pituitary to thyroid and reproductive glands and all. So main function here for main effect on endocrine system that massages does is to reduce the anxiety. It produces relaxation, decreased beta wave activity, increases delta wave activity, and increase in alpha waves. These are being observed in a research done, and when they did EEG on a person who was undergoing the massage, and these were observed. And what does it mean is basically it gives you a better sleep, a better deep sleep. Also, massages increases dopamine and serotonin levels, which are responsible for feeling happy and rewardful kind of feeling that makes you completely stress-free. Happy hormones, you can say it like that. Also, it reduces cortisol, epinephrine, and norepinephrine levels in the blood, which is responsible for, which usually these hormones are produced when you are undergoing stress. Reduces all these things ultimately leads to reduction in like any anxiety or depression, as well as it improves and gives you a sound sleep. Muscular system. When we are manipulating or when we are doing massage, muscles are being manipulated. We kind of press them, pull them, and massage basically we does with a lot of muscles. So what is the first thing that comes in your mind? Definitely, when you have a muscle spasm, suppose your calf muscle got pulled, the first thing instinctively, naturally you'll do is to sit down and try to rub that area or to kind of twist that muscles so that the spasm will go away. So same thing happens in all over your body. Any massages will relieve muscular spasm, reduce the tightness and improve the flexibility of the muscle, increases circulation, which also reduces ischemia, because a lot of muscle tightness and tenderness are all caused by this less circulation, as well as when we are not using muscles on a day-to-day basis, this leads to clogging of the channels and thereby making it more stiff. So massage basically stretches the muscles transversely as well as lengthways, which allows scar tissue, adhesions or fascia surrounding the muscle to loosen and break down. So this can help in muscle repair as well as removing muscle tension. Again, the production of endorphins and all also leads to decreased pain. So decreases the pain in the muscular area. So when you have muscle pains or muscle spasm or muscle stiffness and all, massages usually eases all these problems. Digestive system. No one will think easily like massage has effect on digestive system, but definitely massages promote evacuation of bowel. So those who are having constipation, they can try massaging in a circular motion from your right side to your left side along the ways of colon, and you can actually feel much better difference. It is also very helpful in colic and intestinal gases. Many people might observe when they do massages, they will burp a lot, or they will have a lot of flatulence that clear up the whole digestive system. So it does have an effect on digestion, as well as it improves the absorption from the intestines, because the circulation is definitely increased. There will be no more availability of blood and circulation, so that the nutrients are exchanged in a better way. So absorption is also increased from the intestine. Skeletal system. Skeletal system is again responsible for your figure, your motility and mobility and all. So any type of massages, specifically deep tissue massage or Swedish massages and all, will increase the range of motion. Also, it improves muscular balance and thereby skeletal alignment. Muscles are always attached to bones. So when the muscular balance is achieved, naturally the posture and mobility of the bones are also being improved, and thereby gives you a better posture, better overall appearance and all. Joints are nourished by joint fluid, which is also moved and circulated by massage. Massage can also break down adhesion that can form between tendons and bone, or ligaments and bone. This can be especially helpful after an injury when breaking down excessive scar tissue, which often limits proper functioning. Respiratory system. We said initially about the relaxation response, and it does have an effect on the whole of breathing cycle. So as you all know, like normally when we are stressed or day-to-day life, we usually have like short breaths. But on the other hand, when you do a massage, naturally your breathing will become long and shallow. So it means that you are resting, you are recovering from a highly stressful period. So it also strengthens the respiratory muscles. Different type of massages also helps up in loosening up the rib cage and discharge of phlegm. There are massages that help, not all massages, but again in conditions of asthma, like when you have an acute attack of asthma, it is not really recommended to do a massage, but otherwise it really helps in decreasing the frequency of attack and to improve the overall pulmonary function. So overall relaxation response of massage play a significant role in the pulmonary system. So we are just summing up all these benefits. We discussed how different massages are, like how massages are affecting different systems in our body. So generally, to sum up everything, we can say it reduces fatigue and increases vigor, reduces stress, and it increases relaxation, reducing pain, muscle soreness and tension, improving circulation, energy and alertness, lowering heart rate and blood pressure, improving immune function, improve sleep and reduce anxiety. So since a lot of medical professionals are also attending this particular webinar. So I thought I will include a little bit of research evidence supporting, the effect of massages in different disease condition. So this is a research done for chronic back pain in 2011 from the Annals of Internal Medicine, and they studied like 401 patients in the age group of 20 to 65 years and having non-specific chronic lower back pain. And the result showed that massage is very effective in treating chronic back pain, and the benefits can last even up to 6 months. Another research on the study of depression, anxiety, and stress management. So this is being done by the journal. This is a study from the Journal of Psychosomatic Research on women having stage 1 and 2 breast cancer, and they benefited from the massage therapy. And also it says it can enhance dopamine, serotonin, NK cell number, and lymphocytes. Another study, which was again done by young wrestlers, 15 to 18 years old, shows that massage therapy can decrease the level of depression, anxiety, and stress. Also, it is helpful in improving mental health and performance. When it comes to the quality of sleep, a study on the patients with breast cancer, so that cancer shows that it can improve their quality of sleep. And another research is in the inflammation. This is being done by Science Translational Medicine, shows that the massage therapy can reduce inflammation. Results show that its application to acutely damaged skeletal muscle is clinically beneficial, and it can help in inflammation reduction and promotion of mitochondrial biogenesis. This is in chronic tension headache. A lot of us might have even done this at home, like when we are having headache, we will usually ask our partners or maybe our children or our parents to give us a massage on the head, and most of us got much better by doing it. So this is a study done by the American Journal of Public Health in 2002. It shows that the massage therapy is effective in the reduction of occurrences of headache per week for chronic sufferers. Headaches were reduced even within 1 week of massage treatment. Pain from a chronic tension headache can be alleviated through a specific type of massage treatment. This is then directed to cranial and cervical muscles. It appears as an effective non-pharmacological treatment for pain associated with non-pharmacological treatment. Contraindications. So we spoke about a lot of benefits about massages and its effect on the body and different health conditions and all. Now we are here to talk about the repercussions or contraindications if done in certain status. So fever is a condition where we don't generally advise to do any massages, probably because most of the fevers are contagious, and it can spread from one person to another, and it's a time where your body needs rest. You're including your circulatory system, immune system, lymphatic system is all in attack mode to cure you from particular infection. So it is best to give body a proper rest so that it can recover sooner and become healthier faster. Fracture. There are certain studies done on massages performed on minor fractures, and it provided benefit. But overall, when you say it is a little bit risky to do any type of massage when you're having fracture. So it is a highly contraindicated condition. Open wounds being maybe getting contaminated, or it can be infective if not done in a proper way, and again that part need to be left alone to heal. So any kind of manipulation will make the wound worse. Contagious disease. We are living now in a pandemic, and you know how serious it is to go onto a massage center or a massage therapy when you are having a contagious disease. It can spread into the therapist and other staff that are working, or even to other persons who are coming in that particular center for therapy. So kindly contain yourself when you have a contagious disease. You shouldn't go to any massages when you are suffering from any kind of contagious diseases. Skin diseases, there are certain skin conditions where massage is advised, especially in Ayurveda. We do advise in certain condition, but again, you have to consult a doctor, and whether, you have to make sure that whether your condition can undergo a massage therapy or not. Recent surgery is again a highly contraindicated condition. Deep vein thrombosis. Again, when you do massage on a patient with, or a person with a deep vein thrombosis, the thrombosis or the blood clot can actually get dislodged into the blood and can cause embolism, stroke, ischemia, or heart attack. So it is highly contraindicated condition. Drug and alcohol. So you shouldn't perform, or you shouldn't do massage under the effect of a drug or alcohol. You don't know how the system is gonna react. So kindly refrain yourself from undergoing massage therapy under all this condition. So before going into a massage therapy center, what are the things that you need to look into? First, see that whether the center you are going to get the massage therapy is licensed or not. Secondly, see whether therapist working over there is also a proper person with proper accreditation and education, because without a proper certification, they can really give more harm than good. A lot of people just perform massage as if it is a normal thing to do, but no, you should undergo a proper training. The therapist should have a basic idea about the muscles and bones and almost all the systems I mentioned here. So you are just putting yourself in a harm way when you are undergoing a therapy like a massage therapy from someone who is not certified. Choose the type of massage and duration. So before undergoing any therapy, educate yourself about the type of massage therapy you are doing and how long you take, and also give yourself some free time after the therapy, because we don't recommend doing any strenuous activity immediately after massage. It is to relax yourself. So even after the therapy, try to have some alone time and take rest. Make an appointment. Try always make a prior appointment before going on to any therapy, so that any information that you needed, or if there is anything that is contraindicated, or if particular condition you cannot do, you can always have a conversation with the concerned party in the clinic or therapy center, and you can make necessary arrangements. So always have a phone call with the particular center, and then make an appointment, and then go for the therapy. Share medical history with the doctor or therapist. So if you are trying to make an appointment, or if you're going to a traditional and complementary medicine center, or even to any other massage center, make sure there is a doctor or a certified therapist, and always have an initial conversation with them, and see, just share your medical history and see whether you can, or you are not in a contraindicated state for their particular massage, because those people are educated, and they are certified, and they have a better idea than a layman. So try to check with them whether I'm having hypertension or whatever condition. Always share it with them, with the doctor as well as the therapist, and see whether you are eligible for doing a therapy. Because sometimes in my center, and I say to certain persons that your condition, we cannot do a massage, and try to argue with me, and it makes me really sad, because we've been studying this course like for 5.5 years, and we know when we say certain things. So I think when experts say something, you should respect it. So whoever who's the expert of particular therapy, try to understand and respect whatever they say regarding your health condition. And what you can expect during a massage therapy. Naturally, when you go in for an appointment, if there is a doctor or a therapist, they will take your preliminary health information about your age, height, weight, and your medical history, or any other conditions or surgical history and all. And then they will ask you to go into the room and explain to you regarding what type of therapy is going to be performed, and ask you whether you have any concerns or questions, and ask you to give any suggestions even during the therapy. If the pressure is too much or if the pressure is too low, you can always have a conversation with the therapist while doing the therapy. Another thing that we usually notice is some people, there is not much of a professionalism. These people tend to keep on talking to you, and some people enjoy it. There are people who like to being talked to, but there are people who like silence. So whatever is the thing that you prefer, even if you prefer some music, always try to convey it with a therapist prior to the session so that you can have a more relaxed session without any interruption. And another thing is privacy. Yeah, make sure that the room and particular center is safe, and when you're doing massage, some people don't like to being exposed themselves. So always have a talk to the therapist about how it is being done, and share your concern with them. And there should be a comfortable environment before, during, and after the therapy. And always after a particular session, naturally, any therapist will follow up with you. And you can also follow up with them that, you should do any particular thing, or you should take rest, or can you take shower immediately, or can you go for some sports activity, and all. Always follow up and check with the concerned therapist in the center or concerned doctor, and clear all your doubts regarding that. So being an Ayurvedic doctor myself, it is very difficult for me to stop this or finish this webinar without saying a word about Ayurveda. So Ayurveda is an Indian traditional medical science, and it has been in practice for more than 10,000 of years. The written researches or written evidence of Ayurveda is, we have it from almost 5,000 years back. And when it comes to massage, the oldest evidence also points back to India, because Abhyanga or Ayurvedic oil massage was always a part of lifestyle that is advocated in India or in Ayurvedic science. So Ayurveda advises everyone to have an Abhyanga every day. So in those times, I think my grandfather's time, they used to do oil application. It is not just a proper massage. It's not that you need to go to a place to do it. You can even perform yourself. And there are steps which are being taught to do a self massage. So Abhyanga is not a normal massage, it is a therapeutic massage, and we use this medicated oil for doing Abhyanga in any Ayurvedic center. We have hundreds of medicated oil in Ayurveda, which is recommended for different skin conditions and state and stage of diseases. And if you're a healthy person and if you're a diseased person, we have a conversation first and we decide on the type of oil that we being used. So it is very different from the conventional massage. The word Abhyanga is basically Sanskrit, and it is derived from a word known as Abhyanjana. Abhi means towards or into or upon, and Anjana means to smear or to anoint. So the word Abhyanga means anointment of your body with oil or any forms of sneha or any kind of fat or lotion or oil or anything. So what are the benefits of Abhyanga? Abhyanga cleanses dirt and it improves the bodily complexion, helps to maintain the elasticity of the skin, restore the natural immunity, rejuvenate body tissues, promote health, and prevents aging process. Not literally preventing aging process, but overall it helps to have a more natural, supple, moisturized skin. And a wrinkled, dry skin is more prone for prone for wrinkles, and you get early wrinkles if you have a dry skin. So Abhyanga, doing oil application on a daily basis, can actually prevent it. Also, it has the property to alleviate Vata dosha, which is again responsible for osteoporosis and different other issues related to aging. Abhigada Sahyatva means reduces the effect of trauma, if any, and helps to overcome anxiety as well as stress. Stramahara means relaxes muscles and relieves fatigue, improves the physical strength, promote the excellence of body tissues, beautifies the body figure, induces sound sleep, improves eyesight, recuperates and nourishes the body tissue. And by nourishing the body tissue, Abhyanga prolongs one's lifespan. So all these are written, the words are in Sanskrit because this is a sloka, like a verse, explaining the benefits of Abhyanga in our textbooks that is written in maybe 2nd or 3rd century BC. So I just try to elaborate it in English, and it's definitely it's not a word-to-word translation. It has much more depth to all these points because it's a completely different science, and explaining the basis of Ayurveda will take a long time. So I'm not going into much details, but generally we believe Ayurveda, in Ayurveda, there are 3 doshas, which are basically the functional aspect of human body. So imbalance in these 3 functions can give rise to diseases, and balance of these 3 doshas will give you a healthy long life. So Abhyanga is one of the ways by which you can actually prevent a lot of disease conditions and can maintain a healthy life. Being said all these things, again, there are contraindications for Abhyanga in Ayurveda. Kaphagrasta means suffering from kaphaja disorders, that certain people who are having kapha problems, kapha disorders, it is completely contraindicated. Ajirna, suffering from indigestion, it's not literally indigestion. Again, that's why I said we need to undergo a consultation before undergoing any therapy. It's a different kind of indigestion. Krida Samshuddha, who are just subjected to detox procedure. We have Panchakarma in Ayurveda, which is a complex detoxification procedure. So immediately after performing the detox, your body will be very weak. So in that particular condition, we don't recommend doing Abhyanga. Certain immunocompromised condition, ama. Ama is again considered as a toxin, a latent toxin. And Sama dosha is acute inflammation or infective status. Navajwara, fever. Santarpana Samudra Roga means diseases caused by overnourishment. Nowadays, we have a lot of diseases due to overnourishment. In olden times, we have disorders due to malnourishment. But nowadays we get a lot of nourishment through different means, and even if there is poverty, the food that these people are exposed to is basically high in fat content. So most of the people are mainly suffering due to overnourishment. So Abhyanga is not really indicated in a condition of overnourishment, because Abhyanga itself is a process to nourish your body. Agni Mandya is someone suffering from impaired digestive activity. Agni is fire. So digestion is not, this digestive activity I mentioned here is not only limited to digestive system, it means your cell activity or tissue activity, where in every cell in your body basically needs food. So there is a exchange happens, and there is a fire quality in it to provide this nourishment exchange. So when there is less fire or impaired digestive activity, that leads to a lot of clogging. So in that particular condition too, we don't advise Abhyanga immediately. We generally advise ways by which we can clear that kind of accumulation, and then we will start to increase that particular fire, digestive fire, and then we will do the Abhyanga. By this, I am summing up my talk. I hope you had a better understanding about massage and its effect onto the body, and a small introduction about Ayurveda too. Thank you for giving me an opportunity, and if you have any questions, feel free to ask here. Thank you.
Massage therapy. So before I open the questions to the floor, I have some burning questions for myself. Okay. So I think the first question is it safe for us to do self-massage?
Sorry, is it safe to do self-massage?
Yeah, is it safe to do self-massage? Because nowadays you can see office worker like ourselves always suffers from neck pain, shoulder pain, low back pain. So there's a lot of array of devices out there that is suitable for massage. Is it safe for us to do self-massage?
I would say it is pretty safe, unless you are deep pressure into your muscles and turning it in a very wrong way that could injure you. So it will be highly advisable to get a massage from a trained person, a qualified person. But if it is not available, or if you cannot financially support it, then you can always have a gentle massage at home. That is completely safe. To have more superficial massage, not to put too much of pressure into your muscles. Something a very gentle massage will generally improve the circulation, so that it can really reduces any kind of muscle fatigue or inflammations or anything. So it is, I would say it is safe. And in Ayurveda, as I said, we generally advise to do Abhyanga on a daily basis. So again, there is not too much of deep massage involved. It is more like superficial oil anointment into the body. So it is really very, very beneficial.
Thank you, Dr. Anjali. We have a question from the floor.
Yes.
Hello. Hi. Thank you for your talk. I'm Dr. Titi. I'm a public health specialist. I want to ask you, I used to go for massage, and before massage, usually the masseuse ask me, do you want light pressure, medium pressure, or hard pressure? So I don't know how to choose, but I usually say medium one. Is there any particular like scientific reason which one is the best actually? Thank you.
Okay. Thank you. As far as my experience, like I'm an Ayurvedic practitioner for last 10 years. So there are a lot of people who think, doing a deep pressure massage will only relieve their pain or aches. But I would say it's actually wrong. As you said, it is the moderate pressure or least pressure will be much more beneficial. You don't have to put too much of pressure. So whenever a therapist asks you regarding what kind of pressure you prefer, I would generally recommend my patients to choose moderate pressure or slight pressure, because deep massage can cause sometimes injuries. So, and especially if the particular person who is doing massage on your body is not properly trained, that can also injure you. So it is better to go with moderate or light pressure, I would say.
Okay. Thank you. All right. So we have a question from online, from
Yes.
AJ. So the question was, how safe to have massage therapy during COVID-19? Is there any SOP?
Okay, definitely there are SOPs, issued by the government regarding massage therapies and all. So at the moment, both the therapist as well as the person who is undergoing therapy both need to wear mask and make sure that both of them are not a close contact person, or as well as not having COVID-19 at the moment. And at my center, we regularly do checkups for our staff, at least every week once, to make sure that they are not exposed to COVID-19, because there are a lot of people who are coming here, so we don't want to be a carrier or a center where we transfer COVID to a lot of patients. So there are strict SOPs, and like every center, whether it is a spa or a treatment center or any traditional medicine center or even a physiotherapy center, everyone is definitely following. They have to definitely follow the instructions as per the government. So wearing mask or wearing gloves or wearing face shield, and not doing facials. I think nowadays it is allowed even to do facials, but in our center we are not doing face massage because we don't want the patients or to remove their face mask and get exposed to the therapist. So that is what we are following, and it is okay to do, because as long as you are healthy, it is definitely fine. And because you have to make sure you are not COVID-19 positive person or a close contact. If you are not, it is completely safe to do a massage.
Okay. Thank you, Dr. Anjali. So this is also a very, I would say, questionable question over here. It's asking about what is the difference between chiropractic, physiotherapy, and massage? Is there any similarity?
Okay, I am definitely not a master of any of this, like chiropractic or physiotherapy. All these practices involve massages, and it is, they are doing it as per their science or their qualification. There are different ways. If you ask me whether a physiotherapy massage and Ayurvedic massage is same, it is not. Both are different. And same, I hope it is the same with chiropractor as well as physiotherapy. Generally, those are more related to Swedish massagers, or to manipulate your muscles and your skin to improve the circulation as well as reduce inflammation. So there will be some similarities, definitely. At the same time, there will be differences too, but I am not an expert to point you out exact differences among these. But yeah, thank you.
Dr. Anjali, we have a few more questions. It seems that a lot of interested participants inquiring about massage therapy here. So the next question is there any disadvantage or adverse effects on massage? Is there any risk for it predisposed, particularly to elderly?
I think I have told you about the contraindications of massage. As I said, anyone with diseases, particularly open wounds, or recently after a surgery or anything, there are contraindications. Disadvantages, in sense, it depends on what kind of therapy or massage you are undertaking. Like, sometimes people without knowledge, they go in and do a deep tissue massage. They will ask for a deep tissue massage. Sometimes that will do more damage to their body than good. So that's what I said, you need to go through a qualified personnel, like maybe a physiotherapist or a chiropractor or any traditional medicine practitioners, or at least a qualified massage therapist, and inform them about your concerns, that if you're having a neck pain or back pain or muscle cramps, let them know well in advance that you're having this issue and you are expecting to get a relief from these issues by doing the massage. So if you keep them well informed about your problems, and if it is a qualified personnel, definitely they will do massage accordingly. So you might not have to face any disadvantages of it. And for when it comes to elderly people, generally gentle massages is what we prefer. And again, in Ayurveda, we do have specific oils, especially for elderly people, that are anti-inflammatory, helps with the osteoporosis and to improve with the circulation and to strengthen the muscles and nerves. As you all might know, like I think I already informed that skin is considered to be, one of the organs that absorbs everything faster, more than, when you put something into your mouth. So when you use medications which are actually effective in pain relieving or strength building, through a massage, they will see much better benefits. So we do get people who are really elderly in their 80s and 90s come here and do massages, but definitely not on a daily basis, maybe weekly basis, and they have much improvement. They can do their day-to-day activities more effectively without fatigue or without any tiredness.
Thank you, Dr. Anjali. We have actually have limited time left, about 5 minutes. So we can only open for last 3 questions. So okay. I open to the floor. Any questions from the floor?
Okay, thank you again. So for the frequency of massage, is there any particular frequency that is best for like certain age or certain condition? Yes, that's my question. Thank you.
In Ayurveda, like we do massages on two types. One is if you are a patient that you need a massage as a treatment, then it is recommended to do on a daily basis, maybe for a period of 7 days or 14 days or 21 days. I'm saying this especially when it comes to post stroke patients rehabilitation. In those cases, and not especially some back pain cases, neck pain cases, we do advise to do on every day consecutively for a period of 7 or 14 or even 21 days, depending on the health status. But if you're a healthy person, again in Ayurveda, it is recommended to have oil application every day. But at least due to the current, lifestyle, we may not be able to do it every day. So I would recommend at least once a week, if you could do it at least for an hour, that will be really beneficial. This is from my personal experience I'm saying. So there is not a strict rule as how many times you should do it. There is no scientific evidence or scientific research that being done on it. But as per my qualification and my past experience, I would recommend my patients or who are coming here to do maybe weekly once minimum to keep their health top notch.
Yeah, sorry, Dr. Janjala, we have two more questions. I think the speakers the participants are quite interested about your topic. So the last 2 questions for you: what type of massage is advised for one to have heart problems that withstand or post stroke? And the second question is, what is your take about massage guns?
Okay. Regarding the post-stroke or heart conditions, definitely being an Ayurveda practitioner, I will definitely advise you to go for Ayurvedic massage because we choose the oils according to that patient's health status, and the massage is very gentle. There is not deep pressure involved in our massage, and we do deal with people after post-stroke, and especially in India, it is a very common thing among people. It is very understood one because after the initial days they usually come to any Ayurvedic center, get admitted there, or if the Ayurvedic center is nearby to your home, they come in and do it for like 15 days or 21 days as per the doctor's advice. It's not individual decision. They have to see the doctor, the Ayurvedic doctor, and get the recommendation and do the therapy. So it is advisable to do Ayurvedic massage definitely in these cases. Again, as per the consultation and advice of the doctor. So you have to go and see the doctor personally with all your reports, with all your current medication, and check with the doctor how many days you need to do it or how often you should do it. And regarding massage guns, again, it depends on the injury that person is having. If it is a milder injury or something, then I think using massage guns for the massage should be okay. But if it is something that need a medical intervention, it is better to see a proper qualified doctor or a therapist and then do it as per their advice.
Ladies and gentlemen, we have last burning questions from the floor. Okay, so for pulse posture massage, is it suitable only for those delivered vaginally or also suitable for those with cesareans?
No, we do for both type of deliveries. Vaginal delivery after the delivery, we can do it even immediately. But for cesarean, we would at least wait for around 15 days. And the type of massage we give is a little different from those who undergo vaginal delivery. But you can definitely, both these people can definitely do massage. And I would say they should do massage to make sure that their lower back muscles are more stronger. And it also prevent, from them getting back pain in future. So both of them are open to do massages. Only thing is they have to get a massage from a properly qualified person.
All right, thank you, Dr. Angela, for the talk, and I think with that we conclude the sessions. Okay.
Thank you.
So some housekeeping announcement. Dear delegates, please note that the speedy certificates are tagged with the daily feedbacks form. Please complete the survey and email to us by 5 p.m. Today. E-certificate will be issued today by Wednesday at 5 p.m. Thank you.